And she thought she could hide at the back table, but I'd like to still welcome Madison Baca from Assemblymember Leticia Castillo's office. Thank you all for joining us today. Now, here in the Inland Empire, we've had a diverse and growing community. Just to give you a little bit of context, there are 2.4 million people that live in Riverside County alone. You add that to San Bernardino County, there are 4.5 million people that live in the Inland Empire. We are recognized as one of the fastest growing regions by population in the entire United States, with specifically Western Riverside County being one of the fastest growing metropolitan regions in the entire country, second only to Maricopa County, Arizona. We are expected to almost double our population within the next 20 to 30 years. An important part of that is, candidly, our region's access to healthcare. We have incredible medical providers that are doing a ton of work to try and keep pace with our current level of growth. And as we see that continue to expand, they're going to continue working harder and harder, especially with several of you in the room, trying to make sure that more Inland Empire residents are having steady and reliable access to healthcare. But today's conversation is about an important topic, and that is about the enhanced premium tax credit, something that is going to be going before Congress hopefully in the next couple of months because it's set to expire. And it is going to have, if it's not extended, a direct and immediate impact on an individual or a family's ability to access healthcare, and it's going to have downstream effects on our local business community. So before I welcome our panelists and introduce them to all of you, I'd like to ask you to direct your attention to the brief video on the screen.
Millions of Americans rely on enhanced premium tax credits to afford health coverage. In 2024, these tax credits helped 24 million people get coverage, keeping healthcare accessible for working families, small businesses, and more. But these tax credits will expire in 2025 unless Congress acts. If they're allowed to expire, millions of Americans will face a tough choice: pay much higher premiums or go uninsured. Without coverage, many will delay care until emergencies, leading to overcrowded ERs and higher costs for everyone. The economic impact will be severe. But we can stop this crisis. Congress must act now. Tell Congress to extend the enhanced premium tax credits.
That does deserve it. Okay, well, we've set the table a little bit. Now it's an opportunity to welcome our distinguished group of panelists that are going to be speaking to you all today. Now, we have a number of questions that we've led off in asking them, but I do want to make sure you all know that we will have an opportunity near the end of the program to give you each an opportunity to answer some questions and talk with some of these panelists, especially after the program. So make sure that you know, if you have a question that you want to have asked, that you raise your hand or you speak to one of these panelists afterwards. But it's my pleasure to introduce our distinguished group here. To my immediate left, the CEO of Riverside Community Hospital, Peter Hempstead. Please give him a round of applause. The CEO of the Riverside... There we go, okay. The CEO of the Riverside County Medical Association, Dolores Green. A CPA and lead partner with Singer Luwak Accountants and Consultants, Shannon Carlson. And my peer in the chamber industry, he's the board chairman with the Moreno Valley Chamber of Commerce. He's also a broker and owner of Menke Real Estate, John Menke. So we're going to dive right in with the first question. So I'm going to give each of my panelists an opportunity to respond with their immediate thoughts to this. But the first question goes: the enhanced premium tax credits have helped nearly 1.6 million Californians access health coverage. From your perspective, why is access to affordable health care such a critical issue right now? Peter, you want to start off?
Well, I mean, I think, can you all hear me? I can also just put this down and yell, I promise. So, no, I would just say that right now specifically, we have a lot of, when I look at the numbers, and obviously I have privilege, to see things that come out when this originally was proposed. The numbers and the premiums for families are going to potentially, for those people, especially on the exchanges, are going to go up by some in 200%, which is just not sustainable. With all the inflation and the inflationary pressures on families right now, my concern for anybody at any given time is that they have the ability to get the health care that they want in the hospitals that they want, with the providers that they want. And with this, it's really going to create an issue for people looking to get that. There are a lot of providers out there right now, just quite frankly, that when you think about, and this is going a little bit further, that when you think about the enhanced premium tax credits and you go, say, from a health insurance exchange plan to maybe going back to a Medi-Cal plan or a Medicaid plan, you don't have the access to the same physicians. So that's a big concern of mine for those families that are trying to, look for better options when it comes to healthcare.
Great, thank you. Now, Dolores, I mean, you represent the entire Riverside County Medical Association. From an entire county's perspective, what do you think are going to be the biggest impacts, and why is this an issue right now?
Sure. So what we're seeing, and we represent 3,500 physicians practicing in Riverside County. And what we're seeing is there's kind of this trifecta going on, and it's not a good trifecta. It's the economic, the political, and the public health pressures that's happening with healthcare right now. And we know that 21 million people were able to get coverage under the Covered California and the other health plans. And here in Riverside County, 484,000 people that are working people are in the what we call Covered California, and they are benefiting from these enhanced premium tax credits. And without that, and those people that qualify for the enhanced benefits, the tax credits, they're not making a lot of money, but they're making too much money to qualify for some of the other government programs. And so it helps them to be able to purchase insurance. Otherwise, they would be uninsured. And that causes, as we know, a tremendous amount of problems.
So Shannon, I want you to pick up where Dolores kind of left off. She talks about those that are not making quite enough money, but might be making too much. We talk about this notion about squeezing the middle. Can you speak to that in terms of how this is going to be a big impact and why this is an issue right now?
Yes, absolutely. For my small business owner clients, most of them are taking advantage of the marketplace at this time. Prior to that, so many of them went uninsured because they had to make a choice between paying their bills, paying their vendors, paying their employees, keeping their business running, and paying for their health care insurance. So as you count here, I'm here to bring you some statistics. According to the New England Journal of Medicine in 1950, the U.S. health-related expenditures accounted for 4.6% of the gross domestic product. By 2023, this was 17.6%. I mean, and it sounds like, from what these experts say, that that's going up. Small business owners don't have that kind of bandwidth to just double their insurance costs. So we're talking about, again, our lower and middle income wage earners, our small family-owned businesses, fledgling entrepreneurs, inventors, creators. These are the folks who are impacted by this, but we're all touched by it because we pass those costs along. So it's not just these folks, it's everyone.
Okay. And John, I mean, you come from the perspective of representing also a Chamber of Commerce in Moreno Valley. I mean, give us the total business picture about this impact.
So I'm a small business owner myself, self-employed. I could not have had health insurance when I first started my business if it wasn't for getting it through the marketplace. That's how important it is to small business owners. And when you think about, California is the largest gig economy in the nation. We have about 3.7 million gig workers in California, and you add to that the part-time workers in California, that's 25% of our workforce. These are people who will, because of the nature of their business, rely heavily on the marketplace. About 500,000 Californians currently take advantage of the marketplace. And if you imagine what would happen when they lose that coverage or lose the benefit, many of them are going to be faced with a very hard choice. And will I continue my insurance or will I pay my bills?
So obviously, being a Chamber of Commerce guy, I'm very much focused on that. But before we get to that, I want to come back to Dolores. I mean, Dolores, you alluded to, the impact to public health. And obviously, we've gone through this whole recent time period where public health has been one of the biggest topics of conversation. How is this going to immediately impact public health? And are we going back down a road we don't want to go again?
Right. So what happens is when people become uninsured, they delay care. Their conditions increase dramatically, and then when they finally present, whether it's at the doctor's office or through the emergency room in the hospitals, their conditions have really gotten severe. Advanced cases of cancer, high blood pressure that's causing strokes, just a variety of things by delaying the care because they don't have insurance, and the amount of medical bankruptcies go through the roof. And I don't think any of us want to see those type of things happening to our population. So what will happen is our population will get sicker and sicker because people cannot afford the care. They won't be having their prescriptions filled. So it just kind of snowballs what happens. And then when they present to the doctor's office, they require much more care, much more time to be able to reverse, if they're able to reverse some of these conditions.
But I want to add to that,
Okay.
before we get to our next question. I mean, you're talking about a population, you're talking about residents, you're talking very much in that context. At the same time, this is also our workforce.
That's right.
So
That's
a
right.
sick population is going to then turn into a sick workforce. You want to, Megan, Peter, you had?
I was just going to add to that and just say, if you, and I've heard people say, well, how do you know? How do you know this is going to happen? I mean, no, to that, like, how do you know people are going to delay care? All you have to do, I was here at Riverside Community Hospital. We had the highest COVID census in the entire state, or entire country, excuse me, for my company specifically. Highest population, hands down. So, and honestly, when you look at it, to exactly your point, when you talk about people coming in sicker, just like everyone else, people were scared to go out. They were scared to go to a hospital. They were scared to get care. So when they came in, they were far worse than they would have been if they'd come in for preventative or something else treatment. Because a lot of times we see people that come in and you can catch things earlier. So when we were during COVID, it's a prime example of people delaying care. They came in with much higher acuity. They're to the point where it was a full blockage of their artery versus a preliminary or a partial blockage. So people really do. I mean, we've seen it delay care when they don't have that coverage.
But I want to add to that. I mean, we're obviously talking about the impact to the patient, the resident, the workforce. Let's also, for a quick second, and maybe the both of you can chime in on this, let's talk about your workforce. I mean, the care team, the doctors, the nurses, the technicians. What's going to be that impact now if we have a sicker population?
Sure. So there's a lot of impact of this. Number one, just the resources that are going to be necessary to care for these patients, not just at their primary care level, but the referral to the specialist, the ER again. It's going to take many, many more resources that are strained already here in the Inland Empire. In the Inland Empire, Riverside County especially, we have less than 50% of the physicians needed to take care of our population today, let alone what's going to happen with the increase in the future. So that is going to strain the practices, the medical system. But then what happens too is because the no-show rates will go up tremendously, the loss of patients who are insured, so they're not going to the doctors, that begins an economic snowball for the practices in that revenue is not coming in. So they're looking at having to reduce their workforce, and then we get into that whole economic thing. And the medical community provides about 174,000 jobs in Riverside County. That's huge. It's a huge impact, and as we see, reduction there, it's going to be felt across the economy.
I really wouldn't add. I think you hit the nail on the head. I just think, honestly, she's absolutely right. It's finite resources. We have only so many resources. So when you have people coming in, you know, it's more of a mix of your less acute and then your high acuity. That's a little bit easier to take care of when you do have, you know, people. We only have X number of ICU beds, your highest level of potential care. So if you have a higher percentage of your most acute patients coming in, it creates a recipe for, you know, potentially overburdening on the system.
But Peter, okay, so we're gonna hone in on Riverside Community Hospital for a second. I mean, obviously you're the CEO, Riverside Community Hospital, very valuable medical provider in the Riverside community, in the regional community, but you're also at the same time, you're an employer, you're a business. You know, let's talk about what the business and financial impact would be to the Riverside Community Hospital if these tax credits are not extended.
Well, I mentioned earlier that if these go away, people will go towards and then they won't qualify for Medi-Cal. They'll just be on that like between Medi-Cal and, you know, health insurance exchange. So a lot of times we already said they'll be uninsured. Right now, currently at Riverside Community Hospital, our payer mix, which is probably pretty similar to most of the other places around here, with some exclusions, but is roughly it's 30% Medi-Cal and then it's 50% Medicare. So we're 80% government payer. That's actually a higher proportion of government payer than anywhere else. So what we're seeing is with that proportion, and I'm not just talking about Riverside, so you talk about employers, there are other hospitals around this area that have currently made really difficult decisions to discontinue service lines, to look at, okay, can we stay open? I met with the governor's, you know, liaison for the governor's office about 2 months ago to have a discussion about other hospitals. It's not Riverside, but that are looking at their service lines. There are other hospitals that have closed their shuttered service lines. What that means, though, is that when I have right now at any given time, so this morning at Riverside Community Hospital, I'm not proud of this, but it's just a fact, we have 30 patients who are holding in our ER, which means they've met inpatient criteria and there's not a bed upstairs for them. So what does that mean? That means that we have to do a more efficient job upstairs of getting people moved appropriately through our system. But what it also means, if these other hospitals can't accept these patients or they close service lines down, that's more people coming to us with higher acuity, less care, because honestly, you think about it, if someone's coming with a stroke, we've taken strokes from as far north as Sacramento. If we have to take a stroke from Sacramento, first off, something's wrong with the system. Secondly, it's not as good of an outcome for a patient. So it's concerning if other hospitals look to close their service lines, and it really just turns into, okay, they're going to have you talk about overburdening now, it'll get worse.
Okay, thank you. I want to switch gears a little bit. I mean, we talk about obviously the impact to the medical community in that specific sense. Shanna, let's come to you a little bit. I mean, obviously you work with individuals, you work with businesses. Can you give us an example of potentially one of your clients that, you know, the only way that they were able to access affordable health care was because of this tax credit?
Sure. I want to reiterate that a lot of my small business owner clients use the marketplace, but one in particular stands out. We'll call them Jack and Diane for this scenario. And those of you who don't know that reference, please Google it after. Jack and Diane own a small specialty contracting company here in the Inland Empire. And, you know, they do okay. They aren't wealthy by any stretch. They're not poor either. They are the middle class folks that we are talking about here. And Jack and Diane, before the tax credits came along, frequently had a lean year where they had to go without insurance. So they were actually building back up. They were doing pretty well. Fast forward to 2020. Like so many of us, their business was hugely impacted. They had no money coming in. So they started living off their early retirement money, which comes with all the penalties and everything else. But thanks to the credits, they were able to keep their insurance going, which turned out to be great because in 2021, when they went back to work, Jack had a terrible accident. He was requiring all kinds of surgery. He was basically unable to work for several months. Without some of these expanded credit options, they may have let their insurance go and they would have lost everything, 5 years before their potential retirement date. So this is the prime example of people who have used the credit to save their own life. I mean, without proper care, Jack would have died. But I want to reiterate that this goes beyond that. They would have declared bankruptcy. their medical providers would have then lost that money. Their vendors who were owed money would have lost that money. Their vendors who they pay regularly, the business is gone. They now have to find other people. And their customers who had planned on using them, had contracts with them, would have had to go elsewhere and probably pay higher prices because this wasn't a small local contractor anymore. Now we're talking about something else. So these are the people that this is helping. There are lots of examples by that, but this one is just, it really stands out because of the severity of Jack's injuries. I am happy to report that he recovered and
Okay,
he's back
good.
to work.
I think we were all waiting to hear.
But I think the real message in all of that, the real lesson for all of us is that it's not just one person. When a small business fails, it impacts the community in so many ways. It's not just one person, not just one family, but all of us. All of us end up being touched by it.
And I'm glad Jack is okay. Good. This is a little bit like, you see at the end credits of a movie and they tell you what the next happened to the character in the story, and that's what I was waiting for. So thank you, Shannon. I was going to be worried about that. But I think this sort of really speaks to this idea that these things are not happening in silos. We're not just talking about one issue that somebody is facing. All of a sudden, this has a domino effect on other decisions that are made. Right? So, I think that's the big thing we want to make sure we hear about this. John, I want to switch to you for a second. You made the reference earlier, I think, about a gig economy. And so many jobs in our region are gig-oriented. They are, the Uber drivers of the world. They are, all of these different types where they rely on this, but they have to rely on a marketplace in order to access healthcare. So, give us a sense, again, from the business perspective. You got self-employed, you got gig, you got seasonal, you got part-time. If these tax credits go away, what's going to be the impact for that sector of our economy?
Well, the impact is huge for that sector of the economy because when you think about gig workers, they're not, and even for me, the income isn't steady. It goes with the seasons, and it depends
interest
on
rates.
What the economy and what interest rates and what other things are doing. And so you have to be able to at least rely on something in your life that's steady. I know how much I'm going to pay for my health insurance. And when this goes away, and when you think about in California, when the EPTC was introduced, the number of uninsured people in California was cut about in half. And so you can imagine now those people who have to make that decision of, can I afford to pay health insurance? I can barely afford to pay health insurance. It goes up about 15% a year. And imagine people who are really in that middle income. We're really talking about the middle class people here who are mostly affected. And those people will have to make a choice. Am I going to have health insurance? Am I going to pay my other bills? Am I going to go get some other job because I need a job that's going to provide health insurance now because I can't afford it and I can't take care of my family because I can't afford the insurance? And that affects everything else. And now you've got people who are job hopping, looking for better coverage. They're affecting their employers. And if you're an employer, you know how much money it costs you to hire and train somebody only for them to leave within a year because now they're looking for something else. So it affects every aspect of business. And when you think about those people who then give up their health insurance, and as he said, that they wait and they wait and they wait, and then they go to the emergency room. And they go to the emergency room because that's the only way they can get care. Have you been to the emergency room lately? I have quite a few times recently, and it's always overcrowded. Can you imagine what kind of care you're going to get then? In California, we are projecting that we're going to lose about 6,500 jobs if this doesn't continue. About 3,000 of those jobs are going to be healthcare jobs. So now, imagine that snowball effect as we go. And you want to go see your doctor and get care. all of this just becomes much more difficult.
Yeah.
I was just gonna.
Good.
So I have some numbers too, but someone ran them for me because I'm not a statistician. So, but basically, just it's interesting. Just I want to point out, most people don't know they're getting these credits. Most people sign up for these exchanges, and it's as if you went on and it's already built into the price they're paying. They don't know they're getting it. So that's important to point out and make sure that when they go on, maybe at renewal this October, they're going to see what one price is, which will be interesting. One price is, and then what the price will be if they don't continue. So that'll be very telling. But just to give some facts here, a 60-year-old couple earning $82,000 a year, their premiums are going to go up by $13,000 or 228%. Family of four earning $129,000 a year, annual premiums increase by 62% or $6,021. A family of four earning $64,000 a year, increased by 394% or 2,571. And these are people that currently, with these exchange plans that they have, do not know that they're getting the premium credit. So it's going to be very interesting when it comes to October and people are looking at this when they say, okay, here's what your new premium is going to be if it's extended and if it's not.
Can I add something really quickly?
Please.
I know that he's absolutely right, and a lot of people don't realize they're getting that credit because it's built into the premium they're paying. It's advanced to them. So I know your next question is, well, then there's probably people out there who shouldn't be getting the credit who are. But there are anti-abuse functions built into this credit. So you're getting it for, let's say, 2024, and at the end of 2024, you had a great year, and you didn't really qualify anymore. You're going to pay that back with your tax return. So all of this stuff gets reported on your federal tax return, including that credit, and if you got it, and it reduced your premiums that you didn't really qualify for because you made too much money, you're going to pay it back. So there are anti-abuses built into this thing.
So we talk about, this broad impact. You talked about impacts to families in terms of the premiums. You talk about, this opportunity for abuse being curbed. But John, I want to go back to, you made the comment earlier about the amount of jobs, and I just want to expand this to a broader level. Because obviously we're concerned about the Inland Empire. I think in a broad sense we're concerned about California. Let's also just put it in the context of the entire United States. So if the enhanced premium tax credits expire, because, and I'm looking at these stats right here. If we're talking about medical, we're talking about these business decisions over here. We're talking about the United States could potentially lose up to 285,000 jobs. I mean, you look at the last couple of jobs numbers reports, some steady growth, some steady change, but you can see all of that being wiped out in an instant. You talk about our total GDP, expected to decline by $34 billion, billion with a B. Total economic output shrinking by $57 billion, billion with a B. This loss could also result in $2.1 billion of reduction in state and local tax revenues. So again, fewer dollars for our parks, for our teachers, for our police officers, for our fire departments. And a $5.4 billion drop in federal tax revenue, which, as we all know, federal government already has looked at different ways of trying to deal with the shortfalls they already have, not to mention adding this into the pile. So again, kind of looking at this from a really broad picture, John, I want to add to what you said earlier. I mean, this is going to have a far-reaching impact, not just on the individual healthcare choices that people have to make, but on our total economic output. You want to speak to that?
Well, I think you already hit the nail on the head.
I know, but I just wanted to give you an opportunity to comment.
When you think about 285,000 jobs, and it's not just lost to the GDP. We think about overall what does this mean in tax revenue and so forth. But you have to take this down to that individual level. Your neighbor, your friend, your cousin. 285,000 people losing their jobs simply because we didn't extend a tax credit. I guarantee you everyone in this room is going to know somebody who's affected by a job loss because we didn't act soon enough, because we, as a public, were apathetic. We didn't even know that this was happening, was going away. And I guess that to me is the thing I would really want to stress to everybody here is, don't just, yes, please contact your Congress people, contact your politicians, but contact your friends. Contact the other people that you know who probably don't even know that this is happening, that this is going to go away, and how this might affect them or somebody that they know. And be sure that the people you know about it and are also doing their part to reach out and let our politicians know how important this is to us.
So this is great because, kind of as we wrap up the questions that we've already prepared in advance, we're talking about what's the one message each one of you would convey to this audience as follow-up, as action, as something to be aware of now moving forward. John, I'm gonna summarize yours and say, call your congressman, but call everybody else too, right? Okay.
Absolutely.
Shannon, what would be, if you could wrap up this into a single message for people moving forward, what would you say?
I just want to say once more that this is a problem for all of us. It's not just a few taxpayers. It's not just self-employed folks. It's the entire community who gets hurt by these things. And having this in place for so many people has afforded them the opportunity to protect them, protect their business, protect their employees, protect their livelihoods, and to protect everyone in the community because they're providing services there. So again, this is something that touches all of us.
Okay, Dolores?
I'm going to repeat what John said, is basically it really behooves us and everybody you talk to, all of your friends, family, people you work with, etc., to contact their congresspeople, their U.S. senators, because it is in the hands of those in Washington. And they're the ones that have the ability to extend this tax credit. And it's really, really important that you share personal stories, but you make the call. You call the office and tell them the importance of extending these tax credits.
Thank you. Peter?
I'm not going to add anything prolific. I would just say the same thing you summarized and John said. But I would just say educate yourselves. Yes, share this, but educate yourselves. I mean, you've heard facts, you've heard numbers in front of you today. Take a look. Use Google AI. You can see for yourself what the impacts will be to this area. You'll see what the impacts can be to this country, but just educate yourselves. The most important thing we can do is be out there and be spreading a message and know that it's accurate. So we're telling you that, but share the message and then educate yourselves on it.
We have time for some questions. Any questions from the audience? Linda?
What do you say to a friend who is employed by a large company that pays 100% or a little bit less for their health care, so they think it doesn't impact them at all?
So,
Did you notice how they all jumped on it? Go ahead. Who wants to go first?
go ahead.
I was going to say it absolutely will, because what will happen is with the number of uninsured now increasing in this country, the premiums for people that may get your insurance through your employer that pays 100%, those premiums are going to increase dramatically. And as a result, employers may decide whether or not they can continue to pay 100%, and maybe they cut down, that they're going to pay 50% or 60%, or if they're providing a family coverage, maybe they drop the family coverage, and then that now starts coming out of your paycheck. And so it affects everybody, and I think that's the important message, is we can't sit back on our laurels because our employer pays for our insurance. That could change really, really quickly. And a lot of employers send their, have the option for their employees to purchase on the marketplace. And so again, those premiums are going to go up dramatically, and we all know what will happen there.
Shannon.
I have a statistic. Medical premiums have increased by 54% since 2009, while wages have increased by only 26%. And this is cited as one of the main reasons for wage stagnation in the United States. So that person who's getting their insurance covered, they're probably not getting the increases in their salary that they would maybe see. It's only going to get worse, as Dolores said. So, it absolutely affects them for sure.
Anybody else? Okay. Sir, you had a question.
First of all, thank you for hosting. My name is Wayne with IHP. I was blessed to be in this room in 2013 and get certified as to sell care, which was ironic to come back and the reasons we're talking today. I hear a lot of folks out in the world say, so what? It's someone else. It's them. It's those other people. It's whoever, right? I love where Shannon and you were sharing, Dolores. Can you speak a little bit more beyond premiums? Because everything sounds like fear, right? Fear mongering. This is my 40th year as a health insurance broker. So prior to Obamacare, we had a different format. Some folks seem like that's where we want to go back to. How do you see it, and what else would you share that hits home besides premiums, such as accessibility and other things that would also affect us? So just curious.
Peter, that seems to tie up right to you. I mean, maybe let's go back to the access to healthcare question, right? I mean, premiums are going to be a big issue, but let's focus on access to care. What do you want to add to that?
So IHP is who you work with?
Yeah.
So yes, IHP, when you think about it, IHP has phenomenal coverage and provides care for many people in that Medi-Cal population. But I also know that with IHP, you have a limitation in the providers you can get. And that's what I was kind of speaking to before, is that not all providers are going to accept IHP. Not all providers are going to accept those Medi-Cal plans. So what I'm seeing a lot of times is that moving to this, I just moved back here about a year ago. When I'm looking at a primary care, when I'm looking at other physicians, my choices are going to be limited by what my plan is. And don't get me wrong, at the end of the day, like if you have whatever plan, a plan is better than no plan because you have a choice and you can do it without paying as much out of pocket. But what we're seeing right now, specifically at the hospital, is that a lot of people, and what obviously we talk about premiums, but when they go uncovered, your access to care just goes down significantly. I mean, and I'm preaching to the choir here. You know that. So that's my biggest fear, is that you're going to see a lot of people, and then you think about further down. So if people aren't as insured or have as much people that are in this area aren't insured, and this is one of the higher areas for Medi-Cal or uninsured that I've actually worked specifically. But when you look at that, providers it's hard to recruit. We're one of the biggest providers of graduate medical education in the country, one of the biggest programs. As we're training the next physicians of tomorrow, the next year, they're going to be looking for those jobs that are going to be in more insured or more richly insured areas. So it's really difficult to retain top talent in these areas as well.
Can I'll
Please.
jump in too, because it's just not that population. Again, I mean, how many of us have waited for weeks or months for a specialty appointment, as an appointment with a specialist?
Okay, let's do a show of hands. How
Yeah.
many have had that scenario happen to them?
Right. So as
And I think some
all of
of some of you are maybe still eating, so you didn't raise your hand. I'm going to put that out there.
yeah, and it's very true, unfortunately, because we have such a shortage of physicians already in this area that the access to care is just going to be worse. No matter who you are, whether you're insured, whether you have the means to be able to go to the doctor, maybe pay out of pocket. But again, if there's not enough healthcare providers, the waits are going to increase. And again, that just brings on delayed care. People aren't getting their preventative care, all of the things that go along with it. So again, it's not just an issue with a segment of the population, it affects all of us.
Well, and I want to maybe add to that, and maybe one of you can comment on it, is you know, what we're obviously talking about is a population that is pretty critical to our workforce. So if they are not able to access consistent, reliable care, that means that they are in turn going to be sicker, which in turn means that they're going to be less productive in the workplace, in the economy in general. Anybody want to add comment to that? Or did I steal your thunder?
You kind of covered it. But
Yeah, okay.
yeah.
All right, good enough, good enough. Pete?
Let's assume that our government extends the tax credit. But in listening to the people in the room here, things are not good now. So what else, let's assume that they pass it. But it seems like our country needs more. We're broken in many different ways. Any thoughts on what else, as voters, can we demand of our officials?
That's a good question.
Oh, boy.
Yeah,
That's a
Dolores,
rabbit
how
hole.
much time do you have there, Pete?
Exactly. I think the important part of the message today is the tax credits to ensure they stay in place so 21 million people in the United States can continue their insurance, number one. But, you know, for the healthcare system, and I know that's not our topic today, but, you know, HR 1 is wreaking havoc on the entire healthcare system nationwide. And there is going to be a tremendous amount of ramifications for the reduction in the funding that's coming to the healthcare system, to our universities for research, to pharmaceuticals. So, you know, those are topics all on their own. But, you know, we have mid-year elections coming up, and that's where people can make their voice known for you know, the implications of what's happening through HR 1 with our healthcare system. And we haven't even began to get the impact of that yet, because it's kind of a stacked timeline on that, but it's coming too.
Okay, I know I had a question up here and then a question in the back. So up front?
I mean, I don't even know if I should bring this up today. It's just what's heavy on my heart, because you said something about what are the other alternatives. And I think we've been listening to a lot of the doom, and we're looking at employers. And I deal with businesses all the time, and I'm thinking we got to start thinking proactive. If we can't get these things passed, what are some real things that we can give the businesses? Now, I don't know if this is the right platform, but maybe we need to look at people looking in the mirror, and we got to start taking care of our own health.
Okay. She's angling to be a panelist here real fast. Hold on a second.
Oh, I'm a panelist, and God knows. But my thing is, you know, I know this is the medical industry, but it seems like we're waiting on people and we're saying things are going to get worse. Well, how can things, maybe things might get better if an employer says, well, let's get a wellness program. You know, start looking at where you eat. Start looking at how we can make you better in light of what's going on here. Instead of saying, well, you know what, you're just going to wait for that appointment. You're going to keep getting sicker and sicker. Maybe you know. Maybe look at what's on your plate. Maybe look at how our lifestyles are. What are we telling to our kids? Because employers need to do something different if they're trying to attract the right employee that might say, wait a minute, you're giving me something to look at. Maybe you don't have insurance. Maybe when you get insurance, I'll get it, but you're at least aiming toward my health. That's another conversation, but I wanted to put it out there.
So I'm gonna go maybe a touch off script here, and I'm gonna make sure that at the end of this program, I'm suggesting that you meet to that team right back there at Blue Zones Riverside. Okay, good. Because they would probably love to have a conversation with you about general. Okay, good. All right. I'm just making sure. In the back, I know we had a question. I don't want to forget anybody back there. Good comment there. Thank you. Thank you.
If I could say just
Oh,
real
please, John,
quickly,
go ahead.
So I know people are talking about, well, there's other things we should be looking at, other alternatives, et cetera. But the reason we're here today is because there's a real sense of urgency with this. We are already past the cycle when this should have happened. And
Okay, expand on that a little bit I mean, because I know what you're talking about, but for people that might not follow the legislative cycle, tell us or the healthcare insurance cycle.
Well, and honestly, I'm not an expert, but I know that we missed the boat. We missed the date. And what that means for us is now if this gets approved, we're into that next insurance cycle, which means it's already going to upend the system for people who are getting those benefits now. And we don't even know what that will look like. How do we fix it to make it happen? So we cannot sit back on our laurels and think about, well, maybe there's a better way. Maybe we just need to fix the rest of the system. Maybe there's something else out there. This is the thing that's before us right now that is so important for millions of people. And we can't let politics, business as usual, get in the way of taking action right now and being sure that we're reaching out to people right now to say this needs to happen right now. We cannot wait. We're already too late.
Okay, good. We're going to have a little bit of a follow-up. I know one of our last questions is now about now what? Now what do we do next?
Now it's time to relax.
Yeah. Lynn?
Correct me if I'm wrong, but we still have a mandate to have health insurance in California, right? So if all of these people are dropping off and they're not going to have coverage, they're going to get hit with a tax bill from the state of California.
Let's have the CPA confirm that, yes?
That's correct.
There you
Yes,
go.
that
Okay.
is correct.
That scares me.
Yeah. Yes, ma'am.
Let's encounter that. My name is Dominic Farland. I'm the president of the California Agents and Health Insurance Professionals state chapter.
Okay.
And to clarify that, the penalty is insignificant compared to the premium cost. Exactly. Like that's an easy choice when you're trying to feed your family. Really easy choice that you'll get a penalty over.
Yeah. Fair point. Fair point. Yes, ma'am.
Well, I just want to add to that because I do those who cover California, and it's for me, my husband, and my 24-year-old son. Our health care premium for a high deductible plan is $1,800 a month. So if you're going to ask what's cheaper, the penalty is cheaper because it's only what, 800, 900 or something like that. But I'm paying what, $21,000 a year to have a high deductible plan that doesn't really hardly cover anything. So, I mean, it's clear to me which way people are going to go.
Yeah, and I think that also just, again, and I know that our panelists can probably then speak to that, is unfortunately, a penalty doesn't pay the doctor bill, though, right?
Right.
So.
Why spend $21 on healthcare premium? Why don't you just take that money and just pay for doctors out of pocket?
That's fair. That's fair. Any panelists want to speak to that?
Good is the healthcare
As-
system if you're paying that much in and it doesn't do anything?
Well, as long as you don't have a catastrophic event, right? Preventative care is fine. Right. Exactly. And what we.
Family, if this is what we're talking
Sure,
about,
absolutely.
why are they going to spend $20,000 on healthcare premium when they know they have to pay for it?
Right. And I think all of us can kind of project what's going to happen with the exchange is that, the people who need as we know, insurance is all about a risk pool, right? You have healthies, you have ones that need care, et cetera. But what's going to happen is the ones that really need care and need the insurance are going to try and pay these premiums, and the young and healthies and everybody else, they're going to drop it. And then all of a sudden you can imagine what the risk pool looks like, and it's going to go through the roof.
Okay. Any other? Yes, Crystal.
So just a clarifying question to help understand where we're at with everything. We hear the doom and gloom. We need to do something. I'm all for it. but is there already an action in Congress that's happening? Is there a vote coming up? Or is this what we're trying to at least put on the table? Or is it right now it's expiring? Like, I'm just curious about.
No, there is an opportunity here, and I'll let our panelists jump in there.
Okay, so our first window did pass. However, we have until December 31 to get Congress to extend the enhanced premium credits. Now, what is going to happen, and that's why we now need a full course press on this. It's not going to stop some of the things that are going to start happening this fall, because insurance companies have already started setting their premiums, anticipating that the tax credit is going to go away. So people will, when they go into open enrollment, they're going to see these huge increases. And that's, to me, a prime opportunity to start hitting those Congress people's offices, and you know, to give us the window that the vote happens before December 31st. And so we do have this window. We've missed the window to fix it before open enrollment happens, and so we all know what's going to happen there. But December 31 is our key to get this revised.
Okay, so just so I'm clear, there was a subsidy and then COVID hit and then it became enhanced, right? So the question is, does that mean just the enhanced part is going away, or
Yes.
there's still going to be some subsidy, it's just going to be less, right?
Much less.
Yes, and available to fewer people. Really more targeting the very lower income. Again, people who are still making money, not eligible for Medicaid, Medicare, Medi-Cal, all that, but the people who are kind of in that middle, so the middle class is going to get cut out of it.
And the important part about that's part of what this tax credit does, is that it caps your premium at 8.5% of your income. And so if you're at that 400% of the federal poverty level or higher, your premium gets capped at that 8.5%. That's really important for us, for that middle class. And that's part of what goes away, is when this goes away, that cap goes away. And now you're going to pay whatever that full premium is, plus higher deductibles.
I did want to say really quickly that someone before the event today shared that Senator Schumer introduced a bill this morning to extend this, but who knows where that's going. We need to keep being loud about it, but there is something out there as of this morning.
So I will probably say, if that's something that you want to get involved in, to reach out to our members of Congress on that. We can certainly share that information with you, let you know where that bill is and where it's headed, so that way, if you want to speak up and voice your opinion on that, we can certainly make that happen for you. Any other comments any other questions out there?
Are you going to send out a letter, a form letter kind of thing that we can share?
Yeah, sure, absolutely. We can do that. Well, I'll say this. What we need to do is need to track where that legislation is, and then figure out who the right members of Congress are beyond just our local delegations, right? And then figure out who and how we contact them. So yes, we can do a letter. That's not a problem.
And how are you guys going to let us know this stuff? Because that sounds like a lot of work.
We are equal to the task. I'll put it that way. We can make that happen. That's not a problem.
And if I could just jump in, the letter is great for this legislation that's just been introduced. But the important part right now is to put the pressure on every single member of Congress and the Senate that these tax credits need to be extended. Whatever mechanism that gets introduced, and there will be lots of variations of what's coming down from both parties, but I think the important message right now is just to bombard the offices of our representatives of the importance of extending the credit. Excellent. Not that I wanted to jump over
No, that's
that.
perfect. That's perfect. Yes, get the message out. So I think that's the main thing we want to come away from this panel with is that there is an opportunity here to really have an impactful voice on some legislation that would extend these enhanced premium tax credits for the future, help more Californians, more Americans, but specifically more Inland Empire residents get affordable access to health care than they would if this tax credit does expire. So we will happily do some of that follow-up with you and keep you all engaged on that process. Ladies and gentlemen, please give a round of applause to our panelists. I hope you all learned something. I hope you all got an opportunity to become more informed, and we would challenge you all to not only act in terms of reaching out to your member of Congress, but also to share this message with others, because this has to be a message that's carried by a broad community, not just those in this room. So I want to thank you all for that. I want to, of course, also acknowledge the partnership that made today's event happen. I want to thank my friends at the Moreno Valley Chamber of Commerce, the Black Chamber of Commerce of the Inland Empire, and of course the Greater Riverside Chambers of Commerce. I want to thank them all for being here. Thank you all for attending. Share the message and have a great business day.
Oh my God, you don't hear anything out the White House. As far as like COVID, it's completely, we're looking like a Halloween.